Yes. Yeah, Gurpreet. Go ahead.
Uh, I'm Sardarani Gurpreet Kaur, as you said.
Yes.
I'm from a small town here. It's a Karimnagar, nearby to Hyderabad.
Okay.
So actually, I have got two stories. One is professional as well as another is a personal story.
Great.
Personal means again a family story.
Yes.
So professionally, I have dealt with orthopedicians, neurophysicians, orthosurgeons as well, neurosurgeons as well. I have been working with them for about 10 years.
Mm,
Here we don't get a direct patient.
mm,
As such, it's a small town. Directly from Hyderabad itself, the patients being prescribed for about a period of time for the physiotherapy actually.
mm,
From patients go to Hyderabad, their orthopedician surgeons as well as physicians, they prescribe a limited time actually. We can see the patient, they come with a prescription with us. So we if we say them that it is not a treatment prescribed by surgeons, this is a different treatment, we have to plan your treatment plan. They always negotiate with us. No, we have to go with the same treatment what they have prescribed. So we have to deal with them. It's a complicated, little bit complicated to deal with those patients actually. So what I do, usually I go with them.
mm,
Till now actually you have built such a confidence in me that I can make them understand that this is a different plan, this is a completely different treatment. We go through a plan, a perfect assessment process, a planning, implementation of that treatment, intervention, everything. The prognosis is different. Everything is completely different. They don't understand. As the time goes on, they try to understand, and the conversions has taken place actually through
mm,
these discussions.
mm,
So like that, I have improved my patients.
mm,
I can say that I work a part time with a neurophysician now. I'm working now. What happened? Physician itself started a judge inquiry. He started doing inquiry like that. What she's doing,
mm,
how she's converting a patient. The some things are going on. Politics is going on in the hospital, I can say.
mm,
So what happened? A physician told to his one of the staff that ask her that my wife is dealing with some sort of sciatica. What plan she will give? What video or online classes she may give? Just go and ask her. He
uh-huh,
started inquiring with me all those
mm,
things. I,
mm,
I, I I have understood what's going on.
mm,
I said, yes, I can give you the treatment. You can please go ahead. All those things. I have said everything what I have listened from those million
mm,
dollar counselings. So
mm,
even they are very much surprised with all the treatments I have been going throughout these 3 months.
mm,
So I can say you one thing, sir, ma'am. Whenever a patient comes to me, he comes with a file of 10 to 15 prescriptions. The patient is moving, I can say he's rotating. Physicians rotate them every month.
mm,
They will be coming to the same point. The
mm,
problem doesn't come down, the problem comes to the surgery.
mm,
You can say a problem starts from small pain in a neck or a small pain in a back, and it comes up to the level of surgery. Then patient comes to me, go and do 5 days of treatment of physiotherapy. The
mm,
physicians would say them, now you can go to a physiotherapy, 5 days or 7 days you can take it. If it doesn't work, you can come to me. We will go through the surgery. I have dealt nearly in last 3 months. 3 months, I have dealt about 10 cases. They skipped the surgery. You can. It's a really a big achievement for me.
mm,
In
mm,
sitting
mm.
in the hospital, sitting in front of a physician, I have dealt such patients actually.
Excellent. Excellent.
The physician has surprised completely. How did she did all those things? It's really grateful. I'm grateful to you for these things. And actually, our family, okay, if I jump to my profession, personal life, my family is completely from politics. So always we go through social working, all those things. And in this town, actually, we always, the patients are come nearby villages, we can say. The villages, farmers are the common patients here. So if you go through those patients at the time of harvesting, more common patients are sciatica and cervical spondylosis. They are in real such a pain. I have seen such a pain that at the time of harvesting, at the time of dealing in those third month, last week of third month, doing everyday cutting, they really they come with a so deep pain. If for those patients, physicians make them to move, to come again and again. It's really painful to see them. So doing giving such a treatment to them, it's really from deep of my heart. It is really helpful to them, and they always bless me.
Good.
All these things are going on. It's really so grateful to you. All those blessings coming to me is all through, I can say.
Thank you
It's
so
really
much.
grateful, sir.
Good,
Really
good,
grateful.
good,
The
good, good.
gratitude I can give you, the only thing is gratitude. That's all.
Yeah,
Coming to my family level, everyone are successful in my family. So they always used to call me a dummy doctor before. Actually, dummy doctor in a sense, if we go and deal with any condition or anything, they used to go to a physician, neurophysicians or orthopedicians. They don't come to me. So this has been changed completely. The thing is that in between this last 3 months, everything has changed. Um, the patients coming to us, they are talking to my family members. They are saying that how good doctor she is, how good she is. All those things are going on. It has been completely the change. That life has changed from up to down, down to up. I can
down,
say
down. Yeah,
upside down, upside down. It's completely changed. The
good,
coin, the side of the coin has been changed.
good, good.
That's the
Excellent,
thing I can say.
excellent, excellent, excellent,
Great.
excellent. Very inspirational story, Gurpreet. In fact, we can understand that when a family member says something like this, बाहर वाले क्या बोलते हैं ठीक है, but घर वाले अगर इस तरह से
Yes,
बोलते हैं,
yes, yes.
so it really it pains, right? It
Yes.
pains to an extent that you absolutely are not happy. Okay.
Yes.
अगर ये mindset change हुआ है, तो then it's a great thing that you have already achieved. Okay, because family support is very important. Family support is very important. Families, that push is very important as such, right? So I think you did a fantastic job. See, what we have done is we have basically provided a knowledge, but accepting that knowledge, implementing that knowledge is all up to you, right? So when you accept that abundance of knowledge, and when it's ultimately it's your mindset, right? And it's your you can say the acceptance sort of an attitude as such, which will make you flexible enough to get that knowledge. Okay, and it's your willingness to put it into implementation as such. Okay, and see that result, right? So that is also a great attitude that one has to have it. Okay, so fantastic, you did a great job. We are really happy for you, because one, you have changed your personal attitude, and you are now family supporting, and then your patients are blessing you. Okay, that's excellent. Okay, but again, why not your own clinic as of now?
Yeah, I have my own clinic. Part time, I will go to the doctor because I need a patient. Directly, they don't come to us here. I can collect more enough than near about 4 to 5 patients in my clinic, because only the area, a local area patients may be coming to me. But at the hospital, I can cover more than villages. You can say, I can say that more than 10 to 15 villages there.
Correct.
So
Correct.
I don't want to leave that job because I can help them. Because many of the farmers, many of the patients, they're laborers working, they come to the doctor, like they have a confidence with the doctor that they may come out of those pains, so they come to him, so they trust the doctor
Correct. No,
rather
it is
than
excellent. Not
when
an
they
issue
come
as
there,
such.
they will
Yeah.
change their mindset.
Right, right.
Yes.
That's excellent. That's what, as long as you are able to put this practice there, it is absolutely okay. Okay. I think, you are doing a great job there. Okay. And see to it that the suggestions that are basically provided in the marketing. Okay. So I think, see, one, in a small village as such, it's a great advantage as well. Okay. Don't consider that as a disadvantage. Okay. It's an advantage for you. The reason is, what happens in metros, what happens in the bigger cities, tier 1 and tier 2 cities. Okay, people don't even know who's the other side, right? So they'll just Google out. Okay, so, and based on the Google review ratings and the presence as such. Okay, so they try to go over there and and do that thing as such. But here in a small village as such, you have better options to build that reputation, build that name very fast. Okay, because of the lower circumference as such, the area. Okay, so you could do any sort of a marketing that I have mentioned in the this thing. Okay, and it could be free camp, it could be pamphlets, or there are so many mentioned. Okay, so you can use them, and make sure that you build that reputation, and people should come with your name. Okay, that's very, very simple in a small village as such. Okay, so it's a question of you being available full time, you being available at least for the part time, that yes, यहाँ पे है जो अच्छा treatment मिलता है. Because what usually in the villages or small places basically people speak is more of a health. Okay. Yes. So in every single home, one or the other way, they are facing challenges on health, and that health. Okay, since they are not getting a good the treatments, they have to move all around, all out to this bigger cities as such. So that is an additional cost for them. Okay, so both in terms of stay, in terms of treatment and everything as such. But as you just mentioned, that now in just 3 months itself, you have saved almost 10 plus surgeries. Okay, so that needs to be communicated to the patients. Okay, that needs to be in a way, you must show your work to the people, right? So that becomes viral sort of in a small village as such, right? So it gives you a huge boost. Okay, so I'm sure you'll be able to do it. Plus, in case if you are if you have a very good community also there, okay, of your own Punjabi families and all. Okay, so try to take the free camps also there, right? Try to take the free camps.
At
Okay.
Gurdwara, so I can go with free camps so that I can,
Usually you have a regional communities, right? It could be like Punjabi, it could be Rajasthani, Gujarati, then all the southern families as such. Okay, wherever you have the community centers, try to have the free camp. Okay, speak with them, whosoever as such. Try to have the free camp. Okay, so you'll get a very good this thing over there. Okay, so good. So one thing, okay, definitely develop a better relationships with your the doctors also. Okay, in the hospitals. Okay, and when you start your own as such, okay, make sure that they refer, right? They refer, because see, ultimately what people want is, or what other doctors also want is,
competition,
the good results. Yeah, the good results, right? So if in case if they are expecting the good results, then they will definitely remember your name. Okay, so you should build that reputation. Okay, you should build that rapport, loyalty, trust. Okay, reliability. Okay, कि यहाँ पे consistency results मिलता है. Like yeah, the other physician observed, right? You are saying कि वो क्या online पढ़ती है, क्या online ये कर रही है. थोड़ा सा देखो. You said that his wife itself, right, has a problem, right, of a sciatica, right? So imagine कि वो अपने family के लिए physiotherapy करवाएंगे, लेकिन दूसरों के लिए बोलेंगे surgery या this thing. That is not true. That is not ethically right. But ठीक है. Okay, start building that reputation. Okay, so you should start being a personal brand of your own self as such. It may take time, doesn't matter, because we are all running a marathon. We are not in a sprint. ठीक है, अपना जिंदगी 4 दिन या 5 दिन के लिए है नहीं है. We have almost 40-50 years of a career left, right? So you'll be able to develop that. Okay, but yes, I'm not expecting that 40 साल में होगा. But thing is, okay, over a period you should be able to develop that, right?
Yes, sir.
Good. So thank you so much, Gurpreeth, for sharing your story. You have a lot of rich name. Okay, so that richness has to come. So how much what's your earning now? You are reaching lakh?
Sir?
You are reaching 1 lakh now?
No, sir. No,
because
not
you
now.
are doing a job. So
Yeah.
job है तो वो थोड़ा सा मुश्किल है, right? But ठीक है, over a period of time.
Once I build my repo, then I can go for a marketing.
नहीं, पहले काम करना
money.
पड़ेगा. rapport develop साथ में होगा. Okay, ऐसा नहीं
होगा.
होता है कि पहले rapport develop करेंगे फिर open करेंगे, ऐसा नहीं होता है, right? काम के साथ साथ rapport develop होता है.
काम के साथ साथ rapport होगा.
जितना काम करोगे
बाद में
उतना
I
rapport
can
develop
think
होगा.
of such a money or all those things.
नहीं, you should be able to gain that in the next 6 months maximum. I think that is very much possible. Okay, don't worry about it. But see that कुछ ऐसा कुछ कर सकते हो क्या? देखो कि वहां पे जहाँ पे अगर हॉस्पिटल में अगर 4 घंटा अगर दे रहे हो तो कोई कंसल्टेंट के हिसाब से अगर जाके how many patients do you treat there?
There I go for 20 to 25 patients nearly.
Okay. So
weekly I can say. Weekly
right.
I can say.
Weekly 20-25 patients.
Actually, sir, it depends on the season. Actually, when the patient comes. Now this month I didn't get much patients. Next month, nearly December, I may get more patients. Like that. It depends upon season because the farmers, they come at the time of harvesting, they come to us usually.
See, so don't waste your time as such. Okay,
No.
You should have the productive hours. Okay, so but there are two things. Okay, one, if you are not being productive over there in terms of the patient number of patients as such, okay, try to reduce the time over there and start that particular these things over here, right, in this clinic, right? Secondly, are you working on a fixed salary or are you working on a percentage basis?
No, it's a percentage. It's a 50-50.
50-50.
So,
okay.
Yeah.
So, and what's the charges there?
The charges are 300. 300.
So, are you working as per the PBPA protocol or are you working as per this thing now? 30 days के हिसाब
Now
से काम
I
कर रहे हो?
started working on a PBPA depending upon a case actually. Whoever needs a PBPA, I go for them.
Who decides that?
I decided.
Right. ठीक है. So everybody definitely needs some PBPA. I don't think there is nobody So
but there
that's
are
what.
few
See,
patients,
I think
they come and argue with me that whatever the doctor says, they need only that treatment itself. In those cases, I don't waste much time in arguing with them, but I try to convince them or convert them. If they don't listen, I will just leave them.
Yeah, it
We'll
is
go
not
with another
wasting the time as such, but it is educating the patient as such, right?
Yes.
That's one.
I try to educate them.
Right.
Right.
So, but it is a one-time education. Please understand, Gurpreet. Okay,
Yes,
so
sir.
it is one-time understanding. Okay, one-time education. But once they are convinced, then definitely there is a long-term benefit. Secondly, even if you go for that, okay, so they will have definitely a temporary results, right? So you must tell them that okay, now I am giving, but when it reoccurs. Okay, so don't go for the same kind of a treatment. Definitely it will reoccur. If you go for only the pain management as such, the pain will definitely come back. Okay, so it may depends again on the activities that you
Focus
do.
on the output.
Okay.
What if you go with this treatment and what if you go with this treatment? Right now, if you are not ready for full treatment, no problem. The way sir is saying, okay, if you want only 4, 5 days, 7 days of treatment, go with it. But make sure that again problem will come.
Okay.
But that time what you will again think or what you will do? Better you can start right now for the full treatment, or else do one thing, take this treatment. But obviously, whenever pain will come, that time directly come and start the proper complete treatment.
As per my suggestion,
Yeah.
as per my prescription. ठीक है ना? तो वैसे उनको बोलना है, so that at least they are prepared कि this problem, as Gurpreeth is saying, कि it is going to repeat. So जब आएगा तो they will realize no, what you were telling earlier is true, right? And they'll definitely come back to you. Okay, and start as per your prescription. Okay, just don't live with them because they are not listening for the first time, right? So good. Gurpreet. Okay, so thank you for sharing your story. Okay, I'll be sharing the certificates, sending you the emails as such. Okay, with the certificate, you can take a pic of that. You can take an print of that and get it framed in your clinics and do share in your this thing also. Right. So good.
Yeah.
So thank you for sharing your story, and wish you